Hello, my name is Cherry Lynch Gearing, and I would like to welcome you to the EMT transition course in this handy-dandy little online format. This course is designed to be about 4 hours in length and give you a good idea of why you're transitioning, what's required in the transition, and how to go about completing that process for yourself so that you can continue on with your EMS career. So we're going to get right into this so I don't waste a ton of time, but just a little bit about myself. I work here at Iowa Western. I'm the Director of EMS Education here that I enjoy very, very much. I have been certified as a paramedic for the last, 16 years. And 10 of those years I worked in the field as a lead medic. Truly love EMS. But I found out when we went back home to take care of my mother, and I got a job teaching, I found out I also really like to teach. So this is the best of both worlds for me. Okay. As soon as I can figure out how to get this thing to, there we go. Okay, so let's talk a little bit about how this transition affects you. I know a lot of people coming into our face-to-face transition classes are quite honestly a little bit baffled as to why they have to do this, and sometimes a little bit angry or a little bit frustrated that they have to go through another hoop for the state of Iowa. And so I want to explain this a little bit to you because I think it does have some benefits for you, and once you can understand them and understand the process, this is going to seem like a very easy thing to do. Okay, so one of the reasons that I feel this is a good thing is just to make us as EMS professionals appear to be just exactly what we are, professionals. Now, as a paramedic, I can work side by side an RN in the emergency room, and I can do all of the skills that that RN can do. In fact, sometimes I can do more than that RN can do. But I'm going to work that position for about half the wages that that nurse makes. And that simply boils down to nurses are viewed as professionals. They sit in that professional category in careers. And EMS is still considered blue-collar workers. Because of that, we don't make the money that I think we ought to make, because we have a lot of time and dedication and education and knowledge devoted to get to where we're at. And for even you guys that are volunteers, I volunteer in my hometown. I have had ever since I became an EMT. And you guys are just as valuable. Even though you do it for free, you still should be viewed as professionals, and you should still get back some of the kickback, such as a retirement, such as wages if you would go to work, and maybe funding for your department. So, it's going to increase our pay. It's going to increase our view. I don't know how many times, and I'm sure some of you, if not all of you, can relate to this. As a paramedic who can make you stop breathing and then bring you back, I'm called an ambulance driver. So how long have you been an ambulance driver? And a lot of that, people don't do that to be mean. They just don't understand. But part of that view of getting them to understand is by getting our professional rank up in the career field so that there's a different light shed on us and people begin to understand what we do. Another thing that this transition is going to do is it's going to give us 4 levels. And those 4 levels will be in every state across the board. Now, at the current time, and for some of you that's been around, I know you understand this. At this current time, we've got a boatload of things going on just in Iowa. So in Iowa, we had first responders, and it was the original first responder level. And then we added a couple skills to that first responder, and those first responders became first responder Gs. And then we decided we needed to upgrade and change the first responder level. So now we have first responders 79s and first responder 97s or something like that. The same thing happened with EMTs. We started out certifying people at the EMT A level. A stood for ambulance because that was the first level that could actually transport in an ambulance. And then with that A level and the onset of automated defibrillators came on scene, we said, well, holy cow, we've got to train these EMTs to run these defibrillators. So those EMTs that were aggressive and became trained in defibrillators now became EMTDs, D stood for defibrillator. Well, then we decided to change up kind of how we did our education, and so some of our EMTAs moved up to the new level, which was called EMTB, B as in basic, and became EMTB. Some EMTs stayed at EMTAs, but our new people coming on were EMT basics. Now, on the advanced level, we had intermediates. Intermediates could start IVs, and they had a little more base knowledge about the body, so we called those intermediates EMT intermediates. Well, then we came up with a new level of intermediate in 1999, and so then the old level of intermediates became EMT 85s, and the new ones became I-99s, and we changed that name a little bit, and we affectionately call those Iowa paramedics. Well, when the Iowa paramedics became Iowa paramedics, then the people that were paramedics, which had always been paramedics, now had to be something different, so we had to take some training and upgrade to paramedic specialist. I was one of those paramedic specialists. And then I moved to Colorado, and I said, you know what, I'm a paramedic specialist, guys. And they looked at me like I had three eyes on my head because that level only exists in Iowa. And so, it sounded to them like, wow, aren't you just all that in a bag of chips? So we've got all of this going on in the state of Iowa. And there's all these different levels and all these people running around, and really nobody knows what the scope of practice is for anybody. Now, if I would go to, say, let's hop across the border to Nebraska, okay, or Colorado even. Now, as an EMT in Nebraska, if you take another module or two, you can start an IV. And in Colorado, if you take a weekend course, 3 days, man, you can start IVs, do all kinds of stuff, give drugs. And there's no congruency from state to state to state. Now, if I tell you I'm an RN, that means the same in Connecticut as it does in California, as it does in Colorado, as it does in Timbuktu, because they have a standardized level in their career. We in EMS don't have that. So this transition is going to bring to us the first step in getting to that professional level, and that is getting a unified national scope of practice. Okay. Now, this doesn't mean that we're locked into this scope of practice, but this is the minimum education that this level has had, and the minimums that they can do. So we're going to have 4 levels. When everybody gets transitioned, and everybody will have to transition, or they will not stay certified, those 4 levels are going to be the emergency medical responder, which is very similar to our first responder now, the EMT level, which is very, very similar to the EMT basic level. Then the next level will be the advanced EMT, and that level sits somewhere in between the I-85 and the I-99, kind of a happy medium, a very, very nice level, especially for rural providers. And then the highest level will be paramedic. Okay? It's going to be very simple. Every state will have it. I think all but two states, I believe, are adopting National Registry as their state test. So if you've got your National Registry, or if you get your National Registry, you'll be able to move to any state throughout the nation relatively easily. Okay? Now, if you don't have your National Registry, as an EMT, you're not required to get it. There's no National Registry test at the end of this. fact, there's no test at all. Well, there's a quiz in this course, but there's no state test. And so you'll be able to transition up, but as an EMT in the state of Iowa, everybody in the nation is going to know what your minimum education was and what your minimum scope of practice is. So it's gonna make huge steps. Now we're not going to see this, pay increase overnight, but we've got to start taking some steps to get there, or we're never going to get there. We talked about better public understanding. This is really going to help. We had this big push to educate the public on calling 911 for an emergency. And when that push came through and it became the same number in every state, it became very easy to educate the public. So we're going to see some of that happen when we get the same EMS levels in every state. The public is going to get a better understanding of what we do and how important we are and how vital we are to the medical field and patient care as a whole. Okay. There is a thing called the National Education Standards, and that's all 4 of these levels are based off of these National Education Standards. We used to be trained off of the DOT standards, which wasn't a bad thing. We kind of got plunked under the Department of Transportation because initially that's all we did. We picked up patients, we transported them to the hospital. Very little care was given, if any. And initially that transportation happened in the back of a hearse because that was a vehicle that could accommodate a body that was lying down, had the size in it. We thankfully hopefully have transformed into something much, much greater than that. And so the Department of Transportation probably isn't the very best home for us anymore. And so you can look at the National Education Standards and that national scope of practice if you go to a website, ems.gov. And you'll find those 2 documents there which very clearly outline what the education standards are for each state or for each level and the national scope of practice for each level. Now, the National Education Standards is where we are getting the topics for this course. We took a look at what in Iowa was outlined in regulation as being our minimum education standards. And then we looked at these new education standards, and we identified those items that weren't clearly addressed in the education that you would have gotten as an EMT. So that's what we're going to cover today. Now, some of them you may have covered in your course, but they weren't actually in writing required. And so we're just covering all of our bases and saying, you know what, we're going to make sure that you are trained so that you can transition up and you meet all of their standards and requirements to be at this level. So there isn't many, and we'll talk about those in just a second. Whoops. Okay, so this is going to be a lot easier than you think. You've got 4 short videos to watch. Now this is a 4-hour class if you come to the classroom. You've got 4 short videos to watch. They're a little shorter than they are in the classroom because we don't have the discussion going on. You've got 4 very short quizzes to take after each session. And then you have completed the requirements. So when you certify the next time, you don't have to do this until you recertify. But when your recertification period comes up, there will be a check mark. Okay, now whether you get the card in the mail that says you're going to renew by card and you mail it back in, or whether you do it online, there'll be a little box that says, I have completed all the requirements for the EMT transition. At the end of this course, when your certificate's completed out or printed out, you will then be able to click that and say, yes, I have completed all of the requirements for that transition. Simple as that. Okay, so if you go to, and you can see right up here, the website is http://www.idph.state.gov/. iowa.ems/. Okay? Easy way is if you Google Iowa EMS, this page comes up. Okay? And if you look at this page, right here in the red circle, on the red bar, there's a transition link. They've got all these documents up there for you. So if you click on that transition link, it's going to take you to a screen that looks like this. So let's look at the Iowa Scope of Practice, because what I want to do is I want to show you the difference between an EMT certification and your EMT certification, your new one. There are some differences. So we want to talk about those because I think that's where most people are a little bit frustrated. They've heard rumors and they know a little bit and they feel like they're taking things away from you and you're not going to have the same scope of practice as you did have. So we'll look at that. Okay? Click on that. It brings you up to this page. If you look down at the bottom, there is a Iowa Scope of Practice. Now, I do believe since I created this slide, that has recently been updated. So pick the most recent of the updated scopes of practice and click on it. And it's going to open up to a huge document. Now, if you scroll down, I think that's 30 or 40 pages. But if you scroll down, you'll see a page that says Basic Level Scope of Practice. And this is what we're going to talk about right now, because this really identifies the changes. Now, if you look across here, there's your First Responder 79, the First Responder G, the First Responder 96, the blue shaded ones. This is the EMR. This is the new level, that Emergency Medical Responder. And then you look, here's your EMT A's and D's and EMT B's. Now, this is where you all were. And then you have this new blue shaded level, which is the EMT level. That's where you're going to be at. And as you can see, if you go across, there are some differences there. So let's look at those quick. First difference is right there. If you look at in the right there, EMT Basic, you had two things that were in your scope of practice that now aren't. So let's look over. One is the multi-lumen airway. Okay. We commonly call that combi tube. Okay. Now, if you look at that, was in your scope of practice, it is no longer. Kind of a big deal. Kind of. Okay. Most departments that I've talked with have, prior to this even coming out, started to implement and use the King LT. And the King LT is a tremendous airway. It's easier to put in the combi tube. It's much less bulky. It takes much less time. It's only got one lumen. So there's only one place to put your bag valve mask. And you either have a seal and you're in or you're not. So very handy dandy to use. For the departments, the King LTs run about a third the price of the combi tubes. So economically, they're great. People that have used them really, really like them. And a lot of departments have voluntarily gone that way by choice. So if your department still uses the combi tube, you may want to visit with them and see if we can get trained on the King LT. I think you'll like it. It very nicely replaces the combi tube because it fits right up here in the oral airway. It's what we call a supraglottic. Supra means above. Glottic means the glottis, or the flapper that goes over your esophagus. And so it fits in the oral airway category. That is in your scope of practice as an EMT. So, you've still got a very, very nice airway that's very protected, easy to use, does a great job. And the other one is the esophageal tracheal airway. And this is the EPI-Pen something airway. I can't remember. It is such a dinosaur. I've been doing this for a long time, and I've never even used it. I've never even seen it carried on a squad. So it's not something people use. You actually have to blow up the cuffs with your mouth. So that's not something people were even using anyway, so that's not a big deal. Now if you look down below that, here's a little plus sign. And next to it was nothing. So you've gained something here. If we go over and look, it's CPAP. Now CPAP formerly was a paramedic skill. And we have looked at that and said, you know what? This is a great tool. CPAP stands for Continuous Positive Airway Pressure. Now, a lot of you may know somebody, or you yourself may use CPAP at home at night for sleep apnea. You know, it's a great tool. We have started using it much more in the field, and what we found out is if we can get CPAP on a patient that is headed very quickly down the path of needing to be intubated, we can turn them around. And we avoid that intubation process. We avoid putting them on a ventilator. We avoid all the damage that's done by that. And they start to recover very quickly. So the plus sign there means with your medical training and approval of your medical director, you can add CPAP to your scope of practice as an EMT. Now, not until you transition. It is not in the scope of practice for an EMT basic. So this is something that's going to get added once you take the steps to be transitioned. And that I am very, very excited about. And I think you will too once you spend some time learning about it and get the chance to use it. It is a great tool. Okay. The next change is right down here, and it's the blood glucose monitoring. Now, originally that was pulled out of the EMT scope of practice. And as you can imagine, there was a slight revolt with EMTs in the state of Iowa. Now, if you listen and you think about it, here's the reason why it was actually pulled out. There are a ton of rural departments in the state of Iowa, as there are all over the nation, that have a glucometer in them. And most of those glucometers are set to be calibrated either daily or weekly. And I know in my little small town, gosh, if we've got 10 calls in a year, we've been really, really busy. I can guarantee you that glucometer does not get calibrated like it should. Now, there are regulations, or federal regulations, CLIA is the name of the regulation, that is set up to make sure that these monitors are taken care of so that they are accurate. Because some of these monitors were not accurate, we had responders running out there having a patient that is at an altered level of consciousness. They check a blood sugar and it reads normal. So they're like, well, darn, it can't be the blood sugar. It's got to be something else. So they're busy looking for other things, when actually it was a diabetic issue and it was a faulty glucometer. So if you didn't have a glucometer at all and you went to an altered mental patient status and you got there and they were altered, especially if they had a history of diabetes, you would give them sugar. That should be the treatment that they get, regardless of what that glucometer says. So the thought process behind this was that, EMTs are going to give the same level of care. They should be treating the patient, not the monitor anyway. So if we remove the monitor, we remove that chance of error or that oversight or that misdiagnosis because of equipment error, and we allow the EMTs to do what they do best, and that is treat the patient. So the thought process behind it was good. The reception of that was not. And so in the state of Iowa, we have discussed and decided to add that back into the scope of practice, with the exception that the medical director has to make sure that you're trained, has to make sure that the equipment is adequately maintained in compliance with CLIA, and that he's willing to accept responsibility for your use with that glucometer. Okay? So that's added back in. Now, honestly, most departments, the medical directors are saying, yeah, that's fine, I have no problem, because you guys have already been trained. You guys, for the most part, probably have a method of maintaining and documenting your training and your upkeep of the equipment. But I do want to stress to you that if your department gets audited and you are not maintaining that glucometer to the manufacturer specifications, that's going to be a big ding for you. Okay. Let's look at the next one. Okay. It is right down here, and that's under the auto-injector epinephrine. Okay. Now, if you look, right above that is the EPI-Pen for self or peer rescue. Okay. That didn't change. You can still patient assist an EPI-Pen like you've always been able to. This one applies to, and you can see it was removed, and again it's been added back with that little plus sign. This is the EPI-Pen that you carried on your squad, if you carried one, that is not specifically diagnosed to anybody. It's the backup plan. If you get to somebody who's having an anaphylactic reaction and they don't have an EPI-Pen prescribed, you can use this one. And again, it was pulled out because of making sure, that it was changed out and stored accurately and all of that. At the state of Iowa, we struggled with this a little bit because it's like, wow, this is a life-threatening situation. And if there's not an EPI-Pen available, this patient may die. And there's nothing that says we have less people suffering from anaphylactic reactions than we have in the past. And so this very readily got added back into the scope of practice. So again, if your medical director approves and is willing to make sure that you are trained, which you're going to be trained because you already know how to give it to your peers and do the assisted EPI-Pen. So this was a very easy one for us to say, we're going to add this back in. Okay. All right, next one down here is IV fluid infusion. This one did come out of your scope of practice, and it's not coming back in. This was your ability to transport a patient that had a non-medicated IV running. Okay. What we decided was, if a patient is sick enough that they cannot be transported from one facility to the next without an IV, then they need an advanced level provider with them. If they're only running the IV because they don't want to change it, then the advanced providers can put a saline lock in or a HEP lock in that patient's arm, which is an IV port. They unhook the IV, you transport the patient, and they plug it back in when they get to the next facility. So this does take some responsibility off your guys' shoulders. You no longer have to remember all that med math on calculating drip rates and all that glorious stuff. It truly isn't going to have any bearing on patient care at all because, if you had a sick patient anyway, you had a paramedic there. So I don't think this is a subject that's really going to cause much of a rift. And there was a few providers up in northern Iowa that kind of raised a little bit of a stink about this, and it was reviewed at the state level, and it was very readily said, no, we're not going to change that. So that one's going to stick, and but as far as basic care, it's really not going to change anything. Okay, so that's it. You can see the rest of those pages, there's no changes. So there's just a very few changes, very little change in patient care. Got a couple added skills in there, and there's really pretty good reason for all of it. Alrighty, so let's talk about what is going to be required for you to transition. Okay. So if we go back to that page, we hit that transition link, you'll see over here on the left-hand side are the different levels. And so let's look at the EMTB. If you click on that EMTB, you will pop, whoops, I'm sorry, EMTB, and then click on this transition memo. I'm sorry, right down here. Click on that, and this is what's going to pop up. Now, you probably are never going to see this memo when you go to renew, although it's kind of established for that purpose, because this is mostly just to outline to you what the transition requirements are. Okay, so here are those items that we specifically identified that we need to make absolutely certain you've been trained on so that we meet all of the requirements of those national education standards that the state of Iowa has adopted as their own. So if you look down under, there's a whole provider information, which we're not going to worry about, and then the training requirements underneath that right over here. So you can see the medical one says, I have obtained initial training, continuing education, on-the-job training, or other education which enables me to assess and manage a patient with agitated delirium. And then if you're filling this out, you'd say, okay, I got that in my initial education. I got it through continuing education, which will be your guys' case. I got it through work experience or other. Okay? If you go down, number 2 is to understand the anatomy, physiology, pathophysiology, assessment and management of sickle cell crisis. Okay? Same criteria. If you go up here in trauma, it's asking if you understand the pathophysiology, assessment and management of blast injuries. Okay? And then you go down through special populations. It deals a lot with pediatrics, deals a lot with the elderly, understanding how to do an assessment and care of cardiovascular, respiratory, neurological, etc. diseases. And then some very basic healthcare implications. So, dealing with homelessness, how does that affect us in EMS? Poverty, bariatrics, etc. So we're going to go through each and every one of those in the next 3 sessions. And we'll talk about each one of those so that you can feel very confident in checking that box saying, yes, I've met the requirements of my transition. The next time you renew, and bingo, you're certified. Okay, so down at the bottom here, you can see under the transition instructions, and this is at the bottom of that document, it says EMT basics are required to meet the transition requirements. EMT basics must complete the transition by the renewal date prior to April 1st, 2015. So that means when you transition March 31st of 2014 or March 31st, 2015, that's when you absolutely must transition. So if you haven't already transitioned, that means at your next transition, at your next renewal, you'll have to do that. Okay? So when they complete the transition application, you're going to have to indicate whether you have completed the transition requirements. If you say no, you have not, they will not renew you. Okay, so make sure you check yes on that box. Ready? And that's basically what that says. Alrighty? That is the down and dirty of transition. So I hope that kind of answers some questions. If it doesn't, please feel free to call me and get your questions answered. I think, we've been way ahead of the ball game in Iowa. We started this transition even long before National Registry did. We were one of the leaders in the nation in getting this done. So unfortunately, there were some humps and bumps in figuring out how to make this happen because we actually were training people at the new level before National Registry even had a certification exam at that level. So there was lots of questions. We've conquered most of them. This has really been a fairly smooth process, especially at the EMT level. It's been very smooth. And it's not hard. So what I'm going to have you do now is complete the transition introduction quiz that you're going to find right under this lecture on the course page. And then as soon as you're done with that, you'll be able to view the next lecture, take the quiz. There'll be 3 more sessions. There'll be a short lecture and a quiz after each one. When you're done with that, you'll complete the course assessment. and your certificate will print out, and you will be done. So we thank you for joining the course. We hope you enjoy it, and we will visit with you very, very shortly.